Hello, Dave Truba here. Welcome to Module 11 on environmental cleaning. By the conclusion of this module, you will understand the role of environmental cleaning in maintaining a safe healthcare environment. You'll also be able to describe institutional best practices as well as needed products, processes, supplies, and equipment. Along the way, we'll discuss how these practices relate to wash-fit indicators. Today, healthcare-associated infections, or HAIs, affect millions of patients each year, and rates are more than 2 times higher in low-resource settings. Potentially harmful microorganisms can survive on environmental surfaces for months and be picked up by people's hands if cleaning standards are not met. However, environmental cleaning and disinfection can minimize risk and spread of avoidable infections. Cleaning helps interrupt the spread of potentially harmful microorganisms that may cause a healthcare-associated infection. Environmental cleaning is a part of infection prevention and control measures and standard precautions recommended for all healthcare facilities to prevent infections. Cleaning is especially important in the immediate patient care environment and surfaces that come into contact with intact skin or are touched by healthcare workers' hands. Particular attention needs to be given to high-touch surfaces. That is, any surface frequently touched or in direct physical contact with the patient. Still, even low-touch surfaces like walls and windows can pose a risk and should be cleaned regularly. Anything that is visibly soiled with blood or body fluids must be cleaned and disinfected as soon as possible. Invasive medical equipment requires WHO-guided sterilization, which is outside the scope of this module. These visuals show a flow of transmission beginning with colonized or infected patients and how microorganisms can transfer to environmental surfaces and equipment. If these surfaces aren't properly cleaned, healthcare workers, caretakers, and visitors can contaminate their hands or gloves, potentially infecting susceptible patients. You can see 2 critical intervention points where transmission can be interrupted: environmental cleaning and glove removal, followed by hand hygiene. Cleaning is the physical act of removing foreign and organic material such as dust, soil, blood, secretions, and microorganisms from surfaces. This process, which involves wiping or scrubbing, doesn't necessarily kill microorganisms but physically removes them. It is typically done using water, detergents, and mechanical actions such as friction. Cleaning is always the first step in the environmental cleaning process. Cleaning best practices involve a structured approach that includes organizational support, a staffing plan for each patient care area with backup options, ongoing training, and specific cleaning schedules and procedures aligned with facility policies. Also important are routine quality control audits, along with ensuring the availability of adequate, well-maintained cleaning supplies and infrastructure. Effective cleaning in healthcare settings depends on robust organizational structure and administrative support. A dedicated manager should oversee cleaning activities and be guided by an approved policy and with a specific annual budget. Integrating cleaning into facility operations requires a multi-sectorial planning committee with representatives from all departments, fostering collaboration and aligning cleaning practices with the facility's needs. These discussions can be built into wash-fit meetings. A clear management structure with designated supervisors for different areas ensures thorough oversight. Without adequate staff, the quality of cleaning will be severely compromised. Staffing needs hinge on factors such as number of beds, service types, bed occupancy rates, and specific cleaning tasks. Effective staffing plans also account for worker well-being, with reasonable shift lengths and breaks to prevent fatigue. Flexibility is essential for unforeseen demands, such as outbreaks or surges in patient loads due to extreme weather events. While no universal method exists for setting staffing levels, tools like workload software, comparison with similar facilities, and empirical calculations offer guidance. It is important that cleaning staff have clear roles and performance expectations, ensuring daily presence for sustained cleanliness and infection prevention. If staff understand these elements, even without authority to change staffing or direct implementation, they can help support cleaning staff and advocate for best practices. What should a comprehensive training program include? It should span the basics of infection control, showcasing how diligent cleaning prevents infection spread, to the specifics of using cleaning agents and techniques proficiently. Safety should be a focus. Educating staff on safe cleaning and disinfection practices helps protect themselves and patients. Curricula should also include lessons on water efficiency and conservation to promote environmentally friendly and climate-resilient practices. Pause the video a minute and think about elements of a participatory training and how you could best support cleaners. Training should be interactive and engaging. It should use practical, hands-on methods which meet staff literacy levels. New staff should receive training before starting work and receive refresher training. Include annual refresher courses to maintain high standards of knowledge and skill, particularly when staff turnover is high. These training sessions should fit around cleaners' busy schedules. Of course, cleaners will only be able to put into practice what they have learned with a consistent supply of cleaning materials and post-training support. Teach Clean, created by the Soapbox Collaborative and the London School of Hygiene and Tropical Medicine, is a free training package which has been used in countries like the Gambia, India, Myanmar, and Tanzania. It emphasizes active participation and practical engagement. See the resources section at the end. Let's now look at proper surface cleaning techniques. Begin with a fresh cloth, folding it to create 8 clean surfaces for efficient use. Immerse the cloth in the cleaning solution once to prevent cross-contamination. Use each side of the cloth for cleaning until all are soiled, then dispose of it properly. Switch cloths when they become saturated or when transitioning between patient zones, especially in high-risk areas, to inhibit pathogen spread. Ensure a sufficient supply of cleaning cloths. These practices reinforce thorough cleaning and promote effective use of resources. Clean and soiled items should be separated to prevent cross-contamination. Color-coding cloths can help, and floor cleaning should follow clear protocols with designated mop heads and a 2 or 3 bucket system. Cleaning carts must be cleaned and disinfected after each use, stored securely, and never left unattended. For routine cleaning, no personal protective equipment, or PPE, is typically needed unless there's a spill risk. Terminal cleaning demands reusable rubber gloves. Cleaning high-risk areas requires gowns or plastic aprons, gloves, and face protection. Droplet precautions call for gowns, gloves, and facial protection. Contact precautions need gowns, gloves, and eye protection. Airborne precautions mandate fit, tested respirators and gloves. When handling disinfectants, staff must consult safety data sheets and wear appropriate PPE. Hand hygiene is crucial after PPE removal to minimize contamination spread and ensure staff and patient safety. Cleaning schedules should indicate the frequency and methods of cleaning. This includes specifying the products to be used, the processes for cleaning surfaces, and the persons responsible. Schedules should be informed by the transmission risk level, which can vary from one room or ward to another, or between departments. Areas with higher risk may necessitate the use of different products or processes. For guidance on creating cleaning schedules for patient care areas that correspond to specific risk levels, as well as instructions for calculating your own facility's risk levels, refer to the CDC Best Practices document found in the resource page. Now, let's look at cleaning procedures. Well-defined standard operating procedures, or SOPs, should outline cleaning processes in a clear, step-by-step manner, accommodating different learning styles with both visual and written instructions. A regular supply of cleaning materials, equipment, and PPE, along with hand hygiene supplies, is required. SOPs must also cover the safe disposal and reprocessing of materials, including waste and laundry, and the post-use handling of supplies and equipment, whether they require cleaning, disinfection, or disposal. In addition to schedules and SOPs, visual cleaning records like checklists, maintained in each ward and backed by an SOP, should be available. These records encourage adherence to cleaning policies, provide reminders for consistency, enable task tracking for accountability, and provide a basis for feedback to cleaning staff. They detail the cleaning location, session type, date, and the cleaner's identity, tailored to the staff's literacy levels and placed prominently for easy monitoring. How do you monitor that cleaning is happening correctly and sufficiently? High-tech options like adenosine triphosphate, or ATP, monitoring systems offer precise cleanliness measures, but they aren't always accessible. Less costly methods can still provide valuable assessments of cleaning efficacy. Direct observation and visual checks, though they are simple and might introduce subjectivity, support immediate assessment. Indirect strategies, such as fluorescent gels, identify any remaining residues and offer a less obtrusive way to verify the cleaning, especially in critical touchpoint areas. Immediate, direct feedback to cleaning staff functions can pinpoint areas needing attention and help shape future training. Compile monthly reports to track how well protocols are being adhered to over time. It is important to use a combination of measures that directly assess cleaning, in addition to observational assessments, in order to have the best picture of the performance of the environmental cleaning program. Infrastructure should include a dedicated environmental cleaning services area to store products and tools for ready access and use. The facility is responsible for providing approved cleaning supplies that are effective against a broad spectrum of pathogens. A reliable procurement and supply management system will facilitate this. Lastly, when outfitting patient care areas, materials should be easy to clean, maintain, and repair, resistant to microbial growth, non-porous, and, ideally, without seams. Hard plastics and metals are preferred over wood or cloth due to their lower propensity for harboring bacteria. Let's look at the difference between cleaning and disinfection products. Cleaning products, like liquid soap and detergents, tackle organic material, such as dirt and bodily fluids. Disinfectants, categorized by potency, eradicate microbes from low-level to high-level efficacy. Thorough cleaning should be done before disinfection to remove any organic material that might recontaminate. Routine cleaning often uses neutral detergents, while combined detergent disinfectants also exist. For most tasks, low-level disinfection suffices, but mid-level disinfection may be needed during outbreaks or for blood spills. Please note that all organic material, such as body fluids, and dirt or soilage, must be removed by a cleaning product before application of disinfectants. Environmental cleaning requires a reliable water source. With over 2 billion people facing inadequate water supply, it's essential to conserve water effectively. Avoid letting taps run continuously, especially outdoors. Use a filled bucket for cleaning to limit water use. Minimize tap use for wetting cloths. Regularly inspect taps during cleaning and promptly repair any leaks. Refer to the water module for additional water conservation strategies. Thanks for reaching the end of this module. Key points to remember. Environmental cleaning best practices require solid organizational infrastructure, leadership, staffing, policies, procedures, and budgeting. Training for environmental cleaning staff is essential, as is positive reinforcement through monitoring and feedback. Cleaning schedules and standard operating procedures for all patient areas should be based on their risk level. Selection and management of cleaning products and disinfectants must consider environmental and climate aspects and be carefully managed at the facility level. Don't forget to explore the reference section of this module for links to all mentioned resources.